to discuss more about all of this is Dr. Raj Kalsi. He's an emergency medicine physician. Doctor, really appreciate you taking the time. You know, I was watching an interview you did here on CNN, I think it was 10 or 11 days ago. You said you were scared. I'm just wondering, has that feeling grown or abated?
It's grown, but we are now, Michael, starting to see the surge that has been a phenomenon, a concept in the clinical world is now happening to us. So we've been watching internationally first, and then we watched the epicenter at New York, and now we are starting to experience these patients coming in, and they're coming in more quickly, and they're coming in more sick, and they're needing to be either ventilated or they're about to be ventilated. And the fear that we have is multifactorial, almost like we talked about the last time I was on. Will we have enough equipment? Will we be able to depart from our COVID tunnel vision as doctors and make sure we don't miss other diagnoses, which is really important? And will we have the staff to be well enough and healthy enough to maintain all of the efforts that we need to give to the community?
Yeah, I think a lot of people, it's easy to forget that you guys are busy anyway, normally before all of this, with heart attacks and strokes and car accidents and the like. One thing that you've talked about is the standard procedure when a patient is, I think in hospitals they call it crashing, in immediate risk of dying. I mean, you've got a team that races in, the crash team, to respond. But in this environment, everyone has to stop and gear up, and that must take precious time, right?
Absolutely, Michael. You bring up a great point. And this is such a change in paradigm for everything us nurses and doctors and technicians and all healthcare workers are intrinsically designed to do. And we are rooted in compassion. And the compassion is race into the fire, like police officers and firefighters race into the line of fire or the fire itself and the potential injury. We race into that crashing patient. And the problem is now we have to take our time. We have to don, meaning apply protective equipment, and that takes time. We have to coordinate a strategy to quickly assess this patient, intubate them, ventilate them, this concept you're all hearing about, and then limit exposure to my staff and other patients nearby so that we don't infect other people and we maintain the status of our department.
Yeah, and not infect yourselves. I mean, you're the guys most needed at the moment. I mean, it is interesting, as often happens in times of war as well, the human side can get lost in the sheer numbers. Try to give us a sense of the emotional toll on workers dealing with what they're dealing with, seeing patients die perhaps when they wouldn't under different circumstances.
Michael, I have the honor of having worked a shift today at one of my bigger institutions. We have 400 beds, and I'm honored to work at that institution with amazing people, just amazing people who I hope are watching now, and I'm speaking for them. And we had to tell two patients, one over the phone, two daughters, that their mother was going to be a DNR. And because of this COVID pandemic, we couldn't do more resuscitative efforts. Fortunately, these were amazing family members who did not want their mother to suffer more, so they allowed me to be compassionate and keep her comfortable. And another patient who was very young, 54, and suffering from cancer, we had to pull back the resuscitative efforts, and the family understood. And this was a challenge because that one I had to face in the hospital with the family right at my elbow side, and explain to the patient also, who was quite aware and quite mentally aware to process the situation, that this is just a terrible time internationally. And it's just so unfortunate, Michael, to see these patients die alone, because when we do declare that they are COVID rule-outs, meaning that they could have COVID, they are not able to have family at the bedside unless they are imminently dying because of the risk of co-infecting all of us or other people.
That is just horrific. I don't know how you and your team bear that, the families obviously, but having to tell families, but patients too, and tell them that. I mean, there have now been, it's well over 50 doctors in Italy who have died, many other healthcare professionals as well. I mean, you must have genuine concerns about you, your team, medical workers in general, being taken out through all of this.
So a couple things. One is we are screened as we come into all of the hospitals that I work at to make sure we don't have a cough, a sore throat, shortness of breath, or a fever. The minute we flag one of those people are pulled out appropriately. They're pulled out of the game. And the more we lose to those symptoms, whether it's from COVID or some other illness, which is very obviously prevalent, like another type of cold that's not COVID, we lose that support. And I have 3 kids. I have a wife who's a nurse, and she works at one of the hospitals I work at. And we are fighting for our patients, and we need to be around. I respect so much law enforcement, military, now more than ever, their commitment to the country. This is our calling.
Yeah, I got to ask you, I mean, and I'm sure others do as well from time to time, or I hope they do. How are you doing?
It's hour by hour, Michael, sometimes. I have been doing this 15 years, and I've been through some pretty horrific cases even before this pandemic. Certainly nothing to the depths of what's going on internationally. This is something that's so new and different for all of us as doctors. I have my moments, and I have great people, I have great administration around me who will let me pause, take time, let me vent, and let me just decompress and then get back in the game when I'm ready. And I'm honored to be around the nurses and healthcare workers and the doctors that I work with. I truly am.
Are you shocked that in the wealthiest country in the world that it's in this position, and importantly that prior scenario testing as recently as last year warned precisely these issues, these challenges would arise, and pretty much nothing happened?
I'm not a politician, Michael, but I'll tell you that it is amazing in the most amazing country, and I'm so proud to be a part of this country, that we don't have more resources available. But this is what we have, Michael, and we as healthcare workers, we need optimism now more than anything, and we will get through this. We will all together get through this, and we will get through it only one way, and that is together. Regardless of how this happened, how this came about, we have to move forward. We have to salvage lives. We have to salvage families. We have to salvage emotions. And we need to, by hopefully July or August, come away from this whole. And I think there's going to be a huge paradigm shift in the field of medicine, in healthcare after this, unlike we've ever seen in a decade or two. But we need to come out, and we need to be here for each other. And we have to move forward, Michael.
Well, speaking on behalf of the world, thank you for what you do, and you and everyone around you and throughout the world for what you do. Bravery above and beyond. Thank you so much. Dr. Raj Kalsi, thank you.
Thank you, Michael, for giving us a voice. Thank you.